What I'm going to demonstrate first is the lower GI. The projections for the lower GI are the AP abdomen that consists of two separate AP images. Then we have the LPL, the butterfly, which is the AP axial, and the lateral rectum. Thank you. We'll start by raising the table. To a comfortable height. And when I put in my IR, the first one, I'm putting in crosswise. So we're going to get two crosswise AP abdomens. Make sure that your IR is put in the bucky so that the IR is centered in the bucky. So I've got that red arrow that's the center of the IR matching with the little notch that's on the bracket. I've got to make sure that that IR is snug. I'm using my right marker. And for this first image, that's the higher image, I'm placing the marker superiorly to the outer edge of the IR. Bring over my tube, put the tube in transverse detent. And again, because we're using the table bucky, I'm not concerned about longitudinal detent. That's only when you're using the wall bucky. I'm lining up my tube and bucky. Remember, for you to get a correct readout on the collimator and the correct collimation, your IR has to be seated in the bucky tray properly, and your bucky tray has to be completely closed. My SID is 40 inches on this equipment. We're going to be looking for a readout of either 39.8 or 40.2. For this first image, pardon me, I'm going to palpate for the crest. And the bottom of the light field is going to be placed at the top of the crest. I should have done this first, but I've got to make sure that my patient is straight on the table and centered on the table, and making sure that I'm centered in midline, which I am. Going to give you breathing instructions. Taking a deep breath, blow it all the way out, hold it out, exposure. And I should say at this time too that, of course, these are your post-fluoroscopy images, just like was demonstrated for the upper GI and the esophagram. Post-fluoroscopy or overhead images. Now, our goal between these two AP images is to get the entire abdomen included, which means we want to make sure that all of the intestines are included. The large intestine is included on this image. To make sure that we're doing that, we want to make sure we overlap some anatomy between the first and second image, between the high and low abdomen. We place 3 fingers at the bottom of the light field. And those 3 fingers are in the light. Now then, keeping our fingers there in place, I'm going to move the table so that now my 3 fingers are at the top of the light field, still in the light. That gives us some overlap of anatomy. I'm still centered in midline. Yes, I am, mid-sagittal plate. And change your marker placement for that lower image. For that second lower image, your marker is placed inferiorly on the IR. I'll give breathing instructions. Taking a deep breath, Blow it all the way out. Hold it out, exposure. You may breathe. So when you center for that first image, the high image, I don't know why, but students have a tendency to want to use the 3 fingers, but you don't. When you're centering for that first image, you're just looking for the crest and making sure that the bottom of the light is at the top of the crest. And then after you've taken that first image, that's when you use the 3 fingers when you move the table for the lower image, just to make sure you have the overlap of anatomy. For the LPO, our IR is lengthwise. We're using our left marker this time because it's an LPO. It's an LPO, meaning it's the left surface of the body that's closest to the IR. So I've got this left marker, I'm putting it inferiorly at that far edge of the IR. Tube and bucket are still aligned. I'm still at a 40-inch SID. And how much am I rotating my patient?
45 degrees.
45 degrees. Get your positioning sponge ready behind the patient. Okay. First, scoot toward me just a little bit on the table. Scoot your hips to the left. Okay. We're going to start out with our patient toward the right side of the table. You want that patient to start out straight on the table. Now then, cross your right arm over your chest. I want you to bend up this right knee. Now, I'm going to roll you like a log to your left. And make sure that, especially on a taller patient, that you're positioning your sponge so that you're supporting both the shoulders and the hips. You don't want to place your sponge too low so that you're not supporting the shoulders, and you don't want to place it too high. Keep that arm up. Keep this leg flexed. Whoop, no. Now, did you see what our patient just did?
No.
She scooted like this. That is what your patient's going to do. But if they scoot their behind out, that means that their hips are going to be rotated at a different degree than their shoulders. And you don't want that. You want to make sure that your shoulders are rotated to the same degree as your hips. I'm going to palpate for the crest. And your instructions say to center, what, 1 inch lateral to the elevated side?
Yes.
Okay. That's great. Keep in mind that your objective is to get an image that demonstrates all the intestines, both left and right, ascending and descending. So I have light on the table to the left, and I've centered obviously farther than 1 inch to the elevated side. But what you're going to do is very similar to how we centered for the upper GI. That's a guide, but you may center differently to make sure that you're including both the left and right sides. So, if you're in your simulation, typically I would center 1 inch lateral from midline toward the elevated side. But for this patient, I'm going to center a little differently to make sure that I have both the left and right sides of the intestines on the image. you can have that sliver of light that we've talked about, that thin line of light on the table, but no more than that. This is the LPO. Which flexure is best demonstrated? In other words, best demonstrated as being more open.
The right.
The right. That is correct. Other thing you want to make sure of is that this arm isn't in the light. And that's not as much of an issue as it is for the upper GI. Taking a deep breath, blow it all the way out, hold it out, exposure. You may breathe. I'm going to take this sponge from behind you. Go ahead and lie on your back again. And scoot back to your left just a little bit. So remember, you've had your patient scoot toward you a little bit for the LPO. Now you're going to perform the AP axial. So make sure that you've got them centered on the table again for that. The AP axial angle, anywhere from what, 30 to 40 degrees? So let's say that we're going to angle the tube 35 degrees. We want our SID, after we angle, to remain at 40 inches. So what we have to do initially to make sure that that SID is maintained at 40 inches is we have to lower our tube to compensate for the angle. And you know Ms. Drake taught you that.
5 degrees.
Every 5 degrees is 1 inch.
Right. For every 5 degrees of angle, tube angle, you lower your tube 1 inch. So our angle is going to be 35 degrees. 35 divided by 5 is 7. So there are 7 5-degree angles in that 35-degree angle. Yeah. We start with our tube at the 40-inch SID. From there, we lower it to 33. Yeah. So we started at 40. We have a 35-degree angle on our tube. 35 divided by 5 is 7. So we drop the tube 1 inch for every 5 degrees of angle. So we're going to drop the tube 7 inches. And so we're looking for a readout of 33. 33.1, or I think it's 32.7. I was just trying to get that range for you. New readout is 33. Before I angle, I'm going to move my tube toward the foot of the table. Now I'm going to angle 35 degrees. I look on the collimator for the angle. You guys are used to doing this with your stretcher chest. 35 degrees. So my SID is
40.
40,
Oh, 40.
not 33. I have to line up my tube and bucket. Do I not? Here's what's very important to remember. That I'm lining up the central ray to the IR. So I've got to see that laser on the IR, center of the IR. If I look at the laser where it hits the table, and I line up that laser on the table to the IR, that's going to be wrong. Because as that central ray, as that beam is angled, by the time it hits the IR, it's projected more superior than where it hits the table. I left my left marker on from the LPO. And for the AP axial, I'm going to palpate for the ASIS. And I'm going to center 2 inches below the ASIS. Okay, 2 inches below the ASIS and in midline. Notice too that when I angle my tube, that light elongates. So let's just collimate a smidge vertically. And that readout is about at 12. What we're wanting to include on this image, the AP axial butterfly, is the rectosigmoid area. We don't need the flexures, so I can collimate within reason. Yeah. Okay, I'm going to give you some breathing instructions. Take in a deep breath, blow it all the way out, hold it out, exposure. You may breathe, relax. Thank you. Our last image is the lateral rectum. And for that, you're going to use a 10 by 12 image receptor lengthwise. You're going to center that 10 by 12 image receptor in the bucky. Take off my angle. Realign my central ray to my IR. Close that. Did you notice I didn't hear anything? That's odd. Let me set my SID. I have 40.2. That's interesting. Only after I set my SID did it automatically collimate. That's odd, because you shouldn't need to set your SID for the automatic collimation. And my marker placement is where?
I'm gonna say superior.
I'd like you to turn over to your left side.
So you're saying it depends on if it's a left or right?
Correct.
Okay.
If it's a left lateral rectum, then you're going to use the left marker. Scoot your shoulders back toward me just a little bit. Okay, put your hands up like you're praying. I've got to make sure my patient's centered on the table and straight on the table, and make sure that those shoulders are in a true lateral and that the hips are in a true lateral position. I'm going to palpate for the ASIS. I'm centering at the level of the ASIS. And midway between the ASIS and the posterior sacrum. That's odd. Centering at the level of the ASIS, midway between the ASIS and the posterior sacrum.
Is that basically mid-coronal?
Yes, it is supposed to be mid-coronal. Okay. Taking a deep breath, blow it all the way out, hold it out, exposure, you may breathe, relax. Thank you, ma'am.
Okay.
I got one on the AP axial. We use the left marker. It says right marker. Can we use left or right?
Yep.
Okay.